Hello, everyone. Thank you so much for joining today's webinar, Doing It Ourselves for Everyone, Empowering Communities to Take Action. I would first like to begin by acknowledging that today's webinar is being broadcast on the unceded, traditional, and ancestral territories of the Lekwungen peoples, now known as the Songhees and Esquimalt nations. My name is Rebecca Erickson. I'm a policy analyst at the Canadian Mental Health Association's BC division, and I'm joined by my colleague, Lene Silva.
Hi guys, I'm Lene. I come from the unceded and stolen territories of the Snuneymuxw people. I myself am Squamish, Chilean, and Norwegian. I've been a heroin addict and am still a heroin addict for the last 16 years and have been working in harm reduction for the last 2 years. I work with CMHA as a peer researcher, and I've been working on this project for the last many months, so it's quite close to my heart. I also work in Nanaimo with the primary care outreach team with Island Health providing low barrier primary care. Basically anything a walk-in clinic can do, we can do from a mobile van, which is pretty damn cool. I'm also a peer liaison with the Nanaimo CAT team and co-founder of Open Heart Collaborative, which is a peer-run organization which connects peers to trusted sources and other organizations that we've well vetted. This is my third webinar that I've co-hosted, so I'm really excited about this one. It's going to be a very exciting one, I can tell you that already. Street Degree and Salmon Project are two incredibly impactful peer-run projects that are able to be adapted anywhere, and I think you guys are going to get a lot out of this. So very excited, and back to you, Rebecca.
Thanks, Lene. So we will be your hosts for the next hour. To start us off, I would like to point out a few features of the technology we're using and run through the agenda. So first of all, there are two options for sound. You can listen with your computer's audio or dial in by telephone. If you're having difficulties with one option, please consider switching to the other. A friendly tip that if you do choose the telephone option, either use a landline if you have one, or turn off the output on your computer speakers to prevent that awful feedback noise. And second, we will be recording today's session and posting the video online on the CMHA BC YouTube channel, which you can access at youtube.com/CMHABC. And a copy of the PowerPoint slides is also available to download and can be accessed from the handout section of the panel to your right. After a 10-minute presentation, or two 10-minute presentations, first about the VAN CCAPO Street Degree, and then about the Salmon Project and ODI app, we will move into a panel discussion with our presenters. After the panel, audience members will have the opportunity to ask questions. Please type your questions into the questions section of the panel to your right. Lene will be collecting them throughout the webinar and will read them out to presenters during the Q&A period. If you would like to address your question to a specific presenter, please make a note of this, either by using their name or mentioning their project. We'll try to get to as many questions as possible. So before we introduce our presenters, I'd like to share a bit more about the OD Prep Knowledge Exchange series, including our principles and process. Today's webinar is the fifth installment of a 7-part webinar series called Overdose Prevention and Response Essential Practices, or OD Prep. The project is a partnership between the Community Action Initiative, the Public Health Association of BC, and the Canadian Mental Health Association's BC division. Our work began early 2020 and aims to identify unique practices in peer-led groups and community-based organizations to address overdose and drug poisoning prevention and response. The second aim is to share these essential practices widely. And then the third is to collect information and innovative findings in order to advance policy at a systems level. Another part of this is also our learning community. So we created an online learning community as a space to continue our conversation, connect with one another, and share resources to improve overdose and poisoning response and prevention efforts. I've copied, we will copy the URL into the chat So you can just click on that link and join to be a part of our community. Next, I just wanted to discuss the principles that have been guiding this project. So we chose the term essential practices rather than the more familiar term best practices, because overdose and poisoning response and prevention are not about what we should do, but what we have to do, what is actually essential to save lives in this public health emergency. So what are essential practices? Our peer advisory group came up with these 4 key principles. First off, they're peer partnerships. The voices and actions of people who use drugs are the driving force of change. Secondly, they're grassroots. The practice came from community members taking action. The need, actions, and outcomes were ground up, not top down. Thirdly, they are a part of local networks, peer groups, community action teams, organizations, and municipalities. Whoever was involved shared power and worked together as equal partners. Fourth, they're adaptable. So the practices can be scaled up or down depending on resources or augmented to meet diverse cultural or community needs. Now I'd like to just discuss a bit about our process for this project. Once we had those essential practices, what that means defined, our next step was to find peer groups and community-based organizations who developed and led these practices. So we opened a call for submissions and received many from across the province. We're then faced with the difficult task of deciding who to feature. To do this, we facilitated a series of dialogue sessions with peers and allied service providers to review, discuss, identify important themes, and select the groups. We then met with the groups to learn more about their organizations and practices and to co-develop these webinars. So this brings us to our 7-part series, which covers a range of topics, including brain injury after overdose, safer washrooms and episodic OPS, low barrier shelters, campus drug testing, and safer supply, and more. Today's webinar focuses on how we can empower communities to take action. Now, without further ado, I'd like to introduce you to our first presenter. Eris Nyx is a queer multidisciplinary artist and community organizer living on the unceded territories of the Coast Salish people. Currently working with the Coalition of Peers Dismantling the Drug War, the Downtown East Side SRO Collaborative, and the Black Lab Arts Society. Nyx advocates for police and prison abolition, new models of anti-psychiatry to replace the current regime of psychiatric theory and practice, ending the war on drugs, and fighting against the intersectional harms wrought by colonialization, capitalism, and other systems of oppression. Thanks so much for being here, Eris. I'll now hand things over to you if you'd like to turn your webcam on.
Hello, how we doing? Can you hear me? Are we good? We rolling?
We can hear you.
Great. Next slide. Hello. Next slide, please. So we looked at the data. Guys, pat yourselves on the back right now, okay? Let's do it. Come on, everybody. I'm not gonna make you, but I'm not gonna stop until I see everyone doing it. Let's pat ourselves on the back. There we go. Hey guys, that right there is for saving the world. I'm looking at young minds right now. You guys are all intelligent. I know that you did good in school. I didn't do that. Look at us. We're the machine that keeps the world going, okay? I'd like to start this talk off with a parable, a story, if you will. I was at college, a second tier, not an Ivy League school, a second choice school. And I was in a class, and there was a student in that class, okay? And the teacher, he was spouting out some horrible nonsense about how, it was something about how women's rights are not legitimate, something that everyone knew was false. But if anybody had spoken up, he would have taken extreme joy in failing them, okay? Nobody spoke up. One person raised his voice. One person started talking. The teacher couldn't believe it. The classroom couldn't believe it either. But in the end, he had logic on his side. And at the end of the day, he proved his point. That student was Albert Einstein. And that same sense of childlike play and innocence that we know from Albert Einstein, I can sense in this room today. Hi, I'm Eris Nyx. I'm an important thinker. I'm a creator, innovator, artist, idea. But above all else, I'm a passionate, childlike innovator. I've been all around the globe. We're located on the unceded and stolen territories of the Coast Salish people here in Vancouver. Those are lands belonging to the Squamish, the Musqueam, and the Tsleil-Waututh nations. And we are a coalition that's been organized by and for drug users with the goal of reducing overdoses in our community and dismantling the colonial regime of prohibition by getting folks access to the drugs they want in a safe manner, which includes a regime of education of which our street degree is a part. We do a lot of great stuff, but I won't get into that. Next slide, please. So you got to be thinking to yourselves right now, who's this 22-year-old kid up on stage with a chip on her shoulder and her heart on her sleeve and the world in her eyes? Well, that's a tough question, asking somebody to define who they are. I much prefer to ask, what inspires that person? What inspires you? What inspires you? What inspires you? I want an answer. What inspires you? Now, we looked at the data. We looked at the history of colonization and the drug laws. Turns out they're all racist, starting with indigenous folks being prohibited from being able to drink, moving through with the prohibition against opium, which was leveled at Chinese folks, and then black and brown folks being targeted with the prohibition of cocaine and marijuana. And we looked at the data and the health authorities and these other institutions that fund us. Turns out they're all colonial institutions, and it turns out they aren't really our friends. So we looked at the data, and it turns out these institutions don't really want radical social change or things to improve for marginalized people. And I feel like drug users, by and large, are, do not have the education they need to radically empower themselves, given that they're all getting blown away by this system. And there have been several people that have put forward peer education curriculums, but none of these curriculums were developed by and for the people they were being taught to, and none of them were developed, for the community, by the community. And what's interesting is that the great benevolent government, will not fund peer programs designed and implemented by those people. And I have to ask, what kind of fool would let his enemy teach his children? Next slide. So public health. Now we looked at the data. Public health is big business. It's nepotistic and it's corrupt, and we need to destroy this corrupt system. We can raise money. We can raise money through grants, and that's an environment where it's survival of the fittest. But to be successful in this world of grants and public funding, you have to be able to do things cheaper and do things better than the government, who are quite bad and expensive at doing everything, can do them. So you can write these grants, you can sustain yourself through grants, but eventually they catch on that you've become a little too kooky and they take away your money. So from there on out, we have to figure out how to move forward. There's this hip hop trio. There's a hip hop trio from Buffalo, New York, Griselda, and they have this model for selling streetwear, where they say you can manufacture 100 or 300 champion sweaters for $30 in each, champion sweaters, branded, limited edition, and then you can sell them and you will make $30,000 of profit off of doing this. And it's true. So grants, I don't know, moving forward, because they really don't like it when you empower yourself. Next slide. Now we looked at the data. So stealing and rebranding people's work is the key to success in this industry. Plagiarize. It's big business. They stole from us, So let's steal from them. To the authorities think success is measured by wealth and titles, and their attitude is that if we're not going to lick boots to climb the social ladder, we're not going to win. And it turns out, if we don't want to win, that we should get out of the race. But it also turns out that's a very stupid way of looking at things, because when you come from the standpoint of community care and you're trying to stop your community from suffering, money ceases to become an issue. It turns out, if we really care about our communities, we're going to be doing the work for free, and we're going to be doing it ourselves, and we're going to be doing it unsanctioned. And that's the root of this education curriculum. They run their programming for their masters, and we run it for our people. And so I say to them, racing's in my blood, and if you don't want to win, get out of the race. Next slide. So we looked at the data. Basically, our street degree curriculum is a peer-informed. Here's what they wanted me to tell you. The Vancouver Community Coalition Against Prohibition and Overdose Street Degree is a peer-informed and peer-driven education collaboration with the goal of furthering the work being done by peers in the domains of overdose prevention, safe supply, housing, food security, and outreach. The VanCAPO Street Degree as peers engage and take leadership in content development, and thereby addresses inequality and recreates a hierarchy of expertise while incorporating the wealth of knowledge found in lived experience. This helps break down barriers, decrease discrimination, and empowers peers as pivotal members of our community. Peers have stepped up in both the design and ongoing feedback of this education process, as well as in facilitation of courses. The education series cannot happen without the contribution of blah, blah, blah. Next slide. So there's this document is hosted on the internet. It is 278 pages long. You can check it out. It's actually posted in the handout section of this delightful webinar. You can check it out. All the modules were designed and revised, and it's a living document, all done by people who use drugs, including myself. Clearly, I must be on drugs. Next slide. So we looked at the data. You know, I got what? I brought up my own clock. I didn't have a clock. You know, Malcolm X, you're gonna have to do it yourself. Next slide. Let's leave on a good note. There's this song, it's called Panama by Led Zeppelin, I think. And it goes, Panama, Panama, I'm Eris Nyx. Check out the education curriculum. Thanks the CMHA for having me. I have mental health.
Thanks so much, Eris. And as Eris mentioned, there's a copy of the Van CCAPO Street Degree in the handouts for everyone to download and find out more. I'll now introduce our second presenter. So our second presenter, Upkar Singh Tatlay, he goes by he, him, and his, resides and works on the territory of the Siamu First Nation and is the Director of Scientific Research and Innovative Development of Oxus Machines Works Incorporated, where he oversees the development of healthcare innovations and experimental development R&D projects. He is also the Executive Director of Engaged Communities Canada Society, President of Diversity Boards of Directors, Treasurer with the Bridge for Health, Board Member with SURE Vancouver, Member of the South Asian COVID Task Force, and a Fraser stakeholder at the Indigenous Sport and Recreation Council. I'll now turn things over to Upkar to talk about the Salmon Project and the ODI app.
Good afternoon, everyone. I wish I had some chainmail. Eris, I'm gonna have to borrow that from you. As we begin here today, I do definitely want to state clearly that we work primarily, our work primarily occurs, yes, throughout the Coast Salish region, but on the unceded territory specifically of the Samiamu, Katzie, Kikite, Kwantlen and Tsawwassen First Nations. And that's partly why I am thankful for this conversation today. We're sharing not just our delivered solutions with everyone, but also often neglected or unseen and unheard communities that have never had a voice in any of these dialogues and conversations. So doing it ourselves, as the title says, it's really appropriate. But what I hope it conveys also is that ourselves is not singular. It includes many people, organizations, and stakeholders, and specifically peers who have seen our communities and live our communities. And that seeing is really, really important. They see us because they are of us. They're of these communities. They walk the same path on a daily basis, and they're heavily impacted by the crisis that's ravaging everyone. You know, and this group includes clinicians who are friends of ours, who are racialized themselves, and they see their patients and who are often unseen, and then they're under-resourced and they return home to family members who are suffering from the same cloak of invisibility. You know, includes, we have an amazing cat table here in Surrey that's truly empowered our communities, and it's brought such a diverse range of peers together to work alongside each other, and really has given rise to the projects we're going to talk about today. And that's all unseen populations, unseen and unheard. So all these groups have molded and shaped and led our efforts, and I'll share those efforts with you in a bit. But if we can have the next slide here, maybe, there we go. Yeah, so you know, if the screen's in front of you, I don't have to go into the details. We all live this life here in Canada, in North America. We talk about diversity. We talk about it frequently, and we hold it up and we show it off to the rest of the world. We glean a lot of benefit from it, net benefit from it. And what we aren't mindful of often is the needs and the nuanced needs of all Canadians. We're not doing that. And I won't get into the granular details, like I said, of what you see on the screen in front of you. We live and breathe it daily. But particularly, I want to draw your attention to South of Fraser. It's an area that, even in the context of the Lower Mainland in British Columbia and Canada, is unknown. The sheer demographics that we're dealing with out here, astounding diversity we're dealing with, and rapidly increasing. And along with that, many health needs that those communities have. And a lot of those are now stemming from the toxic drug supply that's mounting daily. Next slide, please. Again, here's a local example. I was just mentioned to you, south of the Fraser. You know, when it comes to racialized communities, we hold the top spot. You know, we have, when it comes to the Somali community, South Asian community, the Black community, the urban Indigenous communities, and on I can go on, but you know, those communities are here. This is where we live. But despite the numbers and despite those demographic studies that have been done, where are we? Do we even exist? Do we have the, you know, that ubiquitous statement, do we have a seat at the table in an authentic way? And it's this seeing and invisibility that's most important today. Recently, Eris and I were talking about it, and I mentioned that the path that's being blazed in the downtown east side and those, you know, those city blocks, it's helping us. It's helping us gain visibility, because the more that ceiling gets moved, the more we're able to stand and say, hey, we're here too. And we're not just shouting alone that we're here. You know, the peers that exist out here that aren't getting the services, we're just trying to get our communities recognized on the PIT counts, and so we can get services. If I can have the next slide. So a bit about our nonprofits. Existed for a long time. You know, we do youth programming, primarily racialized communities, those who are underserved, and it runs the gamut from, like I said, from youth programming, mentorship, food insecurity, harm reduction. Next slide, please. Overdose crisis across Canada. I'm preaching to the choir here, so the stats are in front of you. They're overwhelming. I am going to get into some more details about how this impacts diverse communities and how we're overrepresented in the number of overdose deaths that we see here, before you today. Next slide. Specific again, south of the Fraser in the Fraser region. I was fortunate to collaborate with and work with the Fraser Health Authority on examining some studies and some work that had been done. There's a wonderful epidemiologist that's there, or was there, Brooke Kinnenberg, who'd done some, I would say, groundbreaking work, and to really illuminate for all communities who is actually being impacted by this. You can read for yourself some of the the startling statistics, and I say startling because even today we're sitting here. This was released officially a year ago, but we're still having these conversations, and people's minds get blown when they see these staggering numbers. You look there, South Asian community in the Fraser Health alone had a 255% increase between 3-year period on overdose. Next slide, please. So what did this give us? It gave rise to a couple projects. Eris said it today. We've used it throughout. Our projects are really by the community for all communities. By that we mean these projects are born of the communities that are being impacted. And why was that done? It was ultimately done because we needed solutions right away. We did not have, the privilege to sit by and wait for solutions. And the reason I say we did not have the privilege or luxury to do so, we are of these communities. We're losing our family members. We're losing our peers. We're losing them on a daily basis. And so, although we could have waited for solutions, the grim reality is that just amounted to death, and we don't have that. We didn't have that choice. So what we realized right away is we need to go to the community armed with information, harm reduction, just the messaging, the language, and the dialogue around substance use. It just had not happened in many racialized communities. So we are so thankful that we had in our midst a wonderful peer, his name is Gurkir Sandhu, who was able to become our peer coordinator and really take that message out to the community and really enlist the help of MPH students, other volunteers, other peers as well, and arm themselves with the information that really was going to spur dialogue, perhaps for the first time in racialized communities. You can see some images there of people talking in the community, and that happened in local parks, places of worship, and that really gave rise not only to awareness, but it also actually stimulated the reduction of stigma around this stuff. Having people, peers, go out into the community and lead the charge, it kind of woke people's reality up, or it shook their stereotypes about what is a peer, or what is a drug user, and hold on a second, is this who's talking to me now? So it suddenly shifted their narrative around what drug use is. Next slide, please. And we didn't just want to send them out with this, the standard supplies, because that's all we had. We had standard resources that weren't made for our communities. So what we decided to do was we needed, for the first time, resources built by our community, not resources that are adapted from other communities, but we wanted them to come from our community. And again, one of the luxuries of, I think I mentioned, we have a wonderful cat table in Surrey. We had hosted an event where we were able to glean a lot of information from community. And a lot of that was telling us is that, look, we don't necessarily want resources just for someone who is using substances. We too want to be empowered. And that was a totally different way of looking at how to address this crisis. It was really making it a communal effort. We can almost say like an Eastern response to a global problem. Really shift the narrative on it, make it a communal response by empowering every single person in the community to respond to an overdose. Making sure that people understood this isn't just a us versus them problem. This isn't something that's happening in Wally or in the downtown east side. This is affecting everyone in their homes. So we were able to deploy technology, arm the Salmon Project people with it, and then ultimately arm the entire community with, for the first time, resources built for them in their language, to not only, obviously call 911 if there's an emergency, but also carry on and administer naloxone to identify what does an overdose from toxic drug supplied look like. Next slide, please. And you can see there it had no tracking or data collection. That was really important to the community. So part of working with and listening to community is making sure you develop things in accordance to what their needs truly are. That's everything. You can see the contact information there if you have any questions, but I'm really looking forward to, and by the way, Eris, it's not Led Zeppelin, it's Van Halen. Thank you very much.
Thanks so much, Upkar. We also have uploaded a photo of the ODI app into the handout section, and we will add the URL of the Salmon Project's website for folks to visit and learn more. We'll now open the floor to both presenters for a panel discussion.
Turn your camera on, guys. Don't leave me hanging. I just wanted to say too, right off the bat, like, Eris, I absolutely love your theatrics, and Upkar, what you were saying about it not being us against them. I hear that so often as a drug user. People think that this shit doesn't affect them. Somehow, some way, somebody that uses drugs, or you may run into somebody on the street that is experiencing drug use. It affects everybody, and so I really appreciate that. So yeah, let's just hop into a little bit of a panel chat now. So we got a couple of minutes for each of you to answer the questions. We're just gonna answer or ask them to both of you guys, and you can kind of pick and choose who you wanna go first, or if you want me to pick, I can do that. But one of the first questions is, what were some of the gaps in existing programs and resources and unmet needs in your community that prompted you to get involved and start Street Degree Eris and the Salmon Project Upkar?
Go for it, Eris. What do you got?
Okay, well, in all seriousness, I don't think people in our communities are being resourced to deal with this monumental public health crisis that's happening. And that's a real unfortunate thing, is there are no resources. So we were motivated to start this education curriculum because something like this didn't exist. The resources that have been developed by what I would call the medical industrial complex don't engage the people they're supposed to target. And that, at the end of the day, resources need to be developed by the people who they are for, in tandem with them, not kind of like smashing a round peg into a square hole. So I think at the end of the day, it's like by necessity, because of a crisis, for a community that's been systematically disempowered. And that, we are filling in a gap where if we weren't volunteering time to do this, like this entire curriculum, which is quite a well done document, I must say, we developed for free. We developed it for $4,000, and all of that went to the peers who were participating in its development and the folks doing graphic design and the folks drawing the art for it. We're trying to move to a stage where we have the whole thing, drawn by peers. But I'm like, $4,000 is all it took to make this massive curriculum. And the government, can spend an equal amount of money and develop one module maybe. So our efficacy, our output, because it's driven from a place of care, is much higher, and it's filling a gap that nothing else will fill unless the government wises up and starts choosing to disinvest from the prison industrial complex, which I don't imagine will happen soon. Thanks.
Thank you.
Yeah, I'll just fault. I mean, I don't need to, but essentially, it's the resources we had. As Eris said, they were what they were. So if we had just adapted them, they would have just been a dilution of something that's not really fit for the communities we're trying to serve. So when we went to go figure out, okay, what are these two solutions going to look like? We had to go to community. What do you want? What should this look like? Whether it's the project itself, led by peers, okay, how do you guys want to do this? We really don't know. Right? And if the technology, what should this whole thing be padded out with? What should it be kitted out with? The community, you let us know. So we had to, and if you look at the languages, those translations, those were tailored. They didn't exist, right? We don't have those language translations. And I remember a couple months ago, Eris and I were talking about it. We need to get on that, like making sure that a lot of the translations, the ones we have in Tagalog, in French, and in Hindi, Punjabi, all the languages on the app alone, those didn't exist for us. We had to go out to the community, talk to peers, and sit down at a table and say, how are we going to do this? How are we going to do this together? So yeah, let's, and same thing with us. I mean, luckily we had, a little bit of support going to peers from the CAI, so we're so thankful for that, to lead the Salmon project. But outside of that, it was all bootstrapped. It was like, well, I guess, community's dying and we really don't have a choice. So let's just bootstrap this thing and get it out the door.
And I think that if I can just come in, sorry.
Oh, sorry,
just to what Upkar was saying is there money for translation. This is a huge gap in just finding grant money to even do that. It's not something that people consider, so you have to do it yourselves. The idea that peers could build out a education, that people who use drugs could build out an education curriculum that educates people who use drugs, that can have this kind of rhizomatic outpouring, that's not something anyone wants to fund. So you work with limited resources because of community need. And just translation, it's such a huge thing that pisses me off that people aren't doing more funding streams for translation of materials. And even in Vancouver, like getting things translated to Cantonese, I believe, is the second most spoken language in the downtown east side. I'm like, there's no money to do that, and it's so necessary. So, I think at the end of the day, we need more money to be able to do the things we know are helping people, and it's not really coming, and everything's getting jammed up in bureaucratic, systematic processes that aren't helping the people on the ground. And I'm so grateful that we have so many folks across the province doing work in communities. Vancouver, again, while what I may be doing might seem radical, I can only be so radical because of where I live and because of who I am and because of the color of my skin, So I'm like, I want to be mindful of those things too. And as we move forward, be like, there is a drastic need for these kinds of projects to exist, and we're 5 years behind where we should be in funding them.
Well, there's two things that I'm kind of getting out of this. Is that one, we can absolutely lead by example. Like what Street Degree has done is created this ability for us to take this documentation that's being created, adapt it to our locations, our communities, and share it out and teach it out, as you have said. And the other thing is that there's marginalization within marginalized communities. Like it's not just there's prejudice against what types of drugs you use, the color of your skin, and what type of drugs you use. Whether you're transgendered or cisgendered or all these different things. And I think a lot of that isn't considered. It's just like, okay, opiate crisis, and that's it. So the fact that we're getting these more detailed, more community-driven, people-involved projects is just spectacular. Sorry, I didn't turn off my phone. I should know better than that by now.
No, what you said is so appropriate. Actually, I don't know what this sweatshirt says, Eris, but that's appropriate too, because is it DASEIN?
Yeah, it means their being in Germaning, the happening. Germaning, okay. German, the so happening.
It's appropriate because in the Romanization or Englishization of our language, the Singh is a kind of a formal way of saying, tell us, like you tell us. So it's kind of appropriate you're wearing that, because that's essentially what we're saying is, you tell us, peers. I mean, I've said it often, when we're leading the Salmon project or I'm building out the tech, I don't want to be out there. I don't want to be the one talking about this. You don't want to hear like a sciencey nerd talking about this stuff, talking endless data. You want to have the people who are living this stuff. You want to be having them influence the work that you're doing. And I think in some way, and this is kind of odd to say, we are in an enviable position because, we don't have the resources. We don't have anything. So we are reinventing the wheel. And in some way, we get to do it right. Hopefully we get to do it right.
it's a little bit easier when there is nothing to lose except your loved ones.
Well, we're already losing them. I think with me, I've been driven to the point of insanity because so many people have died. And once you go insane, nothing matters. None of your actions have consequence because you cease to be a cognizantly functional person.
Well, you have to do it. You just have to do it at that point.
Yeah, but it's very Don Quixote fucking chasing windmills kind of mission, seemingly.
Absolutely. Okay, let's move on. Next question. Why is it crucial to mobilize communities most impacted by the overdose and drug poisoning crisis to be involved in the response? I think we kind of just answered that pretty thoroughly. So maybe let's move on to the next one. Working in the nonprofit sector has its challenges since resources and funding are often limited. I know Eris, you're gonna have something to say. How can systems better support and sustain community-led responses to the overdose crisis?
Kurt, why don't you speak first to it?
Well, I think it's just that overall understanding that, and it is shifting the narrative. It's shifting the narrative of who is the holder of knowledge when it comes to different crises in health. Is it a top-down solution? Do you think that it's these treasuries of knowledge that we've amassed over many years and centuries, decades, whatever? Or because we're living in this reality where the landscape is constantly shifting, not only in terms of demographics, but in the reality of what we're contending with. So, go back however many years, and now here we are talking about a toxic drug supply. The wisdom truly resides with the people who are impacted by it. And so if we're looking for government, or let's call it the powers that be, or whoever, policymakers, decision makers, if they're looking at what are the solutions, who do we need to empower, sometimes it's just a matter of getting out of the way. It's more just step aside, let us do the work, let the peers do the work, let the community that's being impacted by this crisis, not just now, but over a protracted period of time, who has that insight over that protracted period of time, let their insights and their lived experience guide the process.
I mean, I couldn't say it better myself, but and I wish I pulled this quote up. There's a James Baldwin quote where he says something to the lines of, the world is held together by 5 or 6 very caring people, and that's really it. 5 or 6 people that care hold the entire world together. And he looks at the camera very seriously. James Baldwin in Paris. He's a very angry man in that film. But at the end of the day, any bureaucracy, anything that is second level, that is not dealing with people on the ground, that is not getting people clothes and shelter and health care and safety, really isn't doing much for anybody. So, and those things are going to happen regardless of if they're funded or not. But when you have, in Vancouver's case, $328 million going to the police force, what's $1 million more to fund community groups? We could do it. That's the thing. When I'm like, we developed a curriculum with $4,000. Imagine what we could do with 100,000. So, and that's like 1/10 of the funding, like, less than 1/10 of the police budget, whatever, less than 1%. It's like a penny, So at the end of the day, I'm like, where are our priorities? And I think as a society, we have questions to ask ourselves about the way we set policy and the way our civic institutions work and these kinds of things that should prioritize everything that was just said, peer voices and the community, because without the people on your side, you really can't get anything done. And I think, in a modern sense, what we're seeing is a domination of technology and this kind of long archaeology of knowledge, this history of knowledge, this just long institutional shift. And it's time to change the way that shift is headed towards empowering grassroots organizations so that they can do their work better. And I don't think, no conversation I've ever had in the last 5 years. I'm not a public policy person. I'm clearly an artist. I don't like doing public policy, and so all of it is not headed towards funding grassroots community groups. It's headed towards policing and repression, and that'll just cause more trauma. And I think we need to, as a society, again, throughout BC and throughout Canada, I guess I should say BC, throughout the entire world, we need to reevaluate the way our systems of power operate and the way they can be harmful and the way they can be shifted. You can't absolutely dissolve the system of power, but you can shift who it targets and the scope and scale of the way it operates. So these are questions we should be asking, but people are still, doing the 1960s Richard Nixon Law and Order, my kids are going to get AIDS kind of ridiculous, certain city council members of Vancouver kind of argumentation. So.
Well, and I think we're missing something too by not having peers in places of power, and also the impact that gives peers by being in a place of power. We lose some of that connection to. Yeah, Eris?
Can I just say one thing to this, because my friend who works for Vancouver Coastal Health was talking to me about this. If you put a peer in and I was dismissed from the BC Center for Disease Control as a peer operations coordinator or something. If you put a single peer or even multiple peers into an institution that is a human meat grinder for marginalized people, they are not going to survive in that environment. So I think there are places where peers excel, and those are grassroots community groups. Empower them so they have equal footing as the larger institutions, rather than trying to merge the peers into the large institutions, because the large institutions are adversarial to the mere existence of those people. It sees them as criminal. We need to empower the smaller institutions to hold more political power rather than centralizing power. And that's my fear is, well, we always need to add a peer coordinator, or let's get a peer this, peer that. But I'm like, why don't we empower the organizations where those people can flourish and actually make decisions rather than argue with a clinical staff or an academic staff or what have you,
You can almost argue that we're here today because of those piecemeal solutions, those little scraps that get offered on the side of a table. So whether we're talking about peers, racialized communities, and earlier I was talking about a seat at the table, and people always say that well, we're making room for people at the table. We have all these DEI committees popping up everywhere. But if you dig into it a little bit and you look at the authenticity and how meaningful those engagements are, they're not really, right? They're just a check in the checkbox and in the column to make sure, hey, look, we're doing the right thing. To do the right thing in an authentic way is hard work, and it really requires this suspending your ego and your control over the power. It's maybe it's dismantling, but it's more equity. Just shaking it up a little bit so you can have equitable sharing of resources and power, so that those communities that you're saying you're serving are truly being served.
And I think to add to that too, just it's discipline. You have to have discipline to not become corrupt, because this industry, and I think that's what I was getting at with my nonsense presentation at the beginning. This industry corrupts people like nobody's business, because if you make the jump from making $30 an hour to $60 an hour because you'll buy the party line, you have to have discipline to not get sucked into this vortex that is set up as a Kafkaesque bureaucracy that prevents you from being able to be authentic.
You know what? Actually, I just want to jump in. It totally reminds me of a story I heard today. I was in a webinar this morning with some other people, and one of the people, when they gave permission to retell the story, was talking about how they had kind of lost their authenticity. If anybody knows Vicki Reynolds, she talks about the zone of fabulousness when you're doing peer work, and was talking about how they lost kind of that center, that balancedness. We don't get a lot of support as peer workers, especially the ones that are frontline workers. As hard as it is being on a table in people that may have PhDs or think that they have a lot more power than us, it's also a lot harder being directly amongst our friends and trying to provide services. And they brought up this story about how this person came up and asked for a bus ticket and was like screaming and yelling at them, and they were really upset, and the person that was getting yelled at got triggered, and they just walked off in a huff and left, and thought about it later and realized that person that they knew very well needed to get to a probation meeting and had absolutely no fucking way to get there. like it's so hard, I think, sometimes not to lose ourselves in this work, no matter where we end up, whether we're on the front line, whether we're on the art side, whether we're on the table side. It's hard work no matter what. We don't get enough support for that in any way. Financially, we should just like anyway. So I just wanted to speak that out. But we have a question from the audience for you, Eris. The curriculum that was developed and the team that developed it, how many people were involved and how long did it take? I know you said you're still working on it.
Well, it's not that we're still working. It's like done. There's like a solid finished curriculum. It's just like we never want the document to not receive feedback from the community. So initially when it was developed with our board. Whoa, okay. It was developed with our board, and that board was 11 people. Then we taught it at Wars Dudes Club and to the SROC, so that was an additional 40 people or whatever. And now we're teaching it to 10 different organizations in Vancouver. So it's been changing the entire time, but it started with just me doing it, and it was really shitty. And I was just like, I'm gonna outdo the health authority to be like, I told you we could do this better, give me goddamn money. You know, when you prove to the health authority you can do something better, that they can do it for cheaper, they'll start giving you contracts, because it's just like hard factual evidence. No matter how much they hate me, they still keep funding me. So there's like a hump you have to go over, where there's a period of time where you're like, I'll never work in this town again. And once you're over that hump and have demonstrated that you'll work for no money to develop resources that are actually functional, the contracts will come back around.
Yeah, 100%. Well, let's end this on a nice note. Question for both of you. Can you, sorry, my dog's got an ear infection. She can't get to the vet till tomorrow because of COVID, so she's whining in the background. But can both of you tell us about a time doing this work has been the most fun, that you've had a positive moment, you know, all the negativity aside? Like, what's one great moment that you guys can both think of? Has there been one? Can you talk about one?
I got one. At the beginning when I was corrected, and it turns out Panama is written by Van Halen, I found that so fucking funny, man. I'm like, nice one, loved it, great way to conclude. So there's lots of laughter, you know. That's what I'm trying to say with this doesn't all have to be drab, dreary. I didn't turn my phone off either. It doesn't all have to be drab, dreary nonsense. Like, have some fun, for Christ's sakes. Like, you know, if you go to New Orleans and you see a funeral, it's like a fun time, even if it's sad. And I'm like, there's no reason just because things are sad that they have to be boring. So keep the peace and keep on keeping on, and you can have the last word, because Jesus, I think it'll be better than what I just did.
Not at all. No. You know, fun time. We had to, like I was saying, we had to invent the resources ourselves. And when we were translating, we were coding for simplified Chinese, some of the resources around naloxone, and the statement was, I need a kit. I ended up coding, I want eggs. And so and I actually pushed it out in a beta version, and so I didn't hear the end of it. So that was, you know, like Eris said, you got to find the humor in this, because otherwise, you know, I don't want to go there. But yeah,
That's awesome. Thank you guys so much. Do we have any more questions from the audience? Upkar, there we go. Upkar, is your app most relevant to the Fraser region, or might other folks across BC download and use it?
across Canada, yeah. I mean, surprise, surprise. Chinese, Punjabi, all these languages, and many more. They're not just spoken south of Fraser. You'll find people who look like this throughout the world. So yeah, you can use it. You don't have to be a Surrey resident to use the app. It's you know, it's intended for everyone. Hey, there's English in it. So you know, the idea, it really is, like I said before, is, you know, flip the script on the whole thing, empower the community, right? Because the more we ostracize that this is, hey, that's a problem for a segment of the population, let's just drive resources that way and solutions that way, you're really compartmentalizing it. And so what we're trying to do, in addition to provide resources, is really shift the narrative on who this is impacting, and ultimately that's everybody.
So I just wanted to say thank you all so much. This was incredible, and I've been so excited to have this meeting. It's amazing.
So yeah, thank you so much to both our presenters, Upkar and Eris, as well as to all of our audience members for joining today. And just a reminder that you can watch the recording of today's webinar, as well as all of the other OD Prep webinars on our YouTube channel there. And a reminder to join us on our learning community.